Let's now get more insight. We can cross to Brad Stein. He's the senior natural scientist at the Rand Corporation, and he's joining us from Pittsburgh, Pennsylvania. Thank you again.
Pleased to be here, Rachelle.
Now, Brad, the Center for Disease Control says deaths from overdoses are reaching levels similar to the HIV epidemic at its peak. Why are we seeing this spike in numbers?
I really think the spike in overdoses is related to just the greater increase in people who are misusing and becoming addicted to heroin and prescription painkillers.
Now, other than the human toll, you also have the economic toll. Substance abuse, as Sean was saying, cost the U.S. $81 billion in lost productivity. So what are employers doing to curb this?
You know, I think this is a problem that's going to take all members of society to really chip in. Employers making sure that employees have insurance and are encouraged to seek treatment. Oftentimes people may be very cautious or concerned about seeking treatment for addiction to these medications because they're afraid they'll lose their jobs. But at the same time, I think we need treatment providers stepping up, a range of efforts to make treatment more available to people and to reduce the stigma from seeking treatment.
And as you mentioned, it should be that holistic approach. And we're seeing lawmakers trying to push through more government funding to help fight drug abuse. But should this fall more on the government, or should the private sector or even Big Pharma be really stepping it up to tackle this issue?
You know, I think everyone really needs to play a role here. Certainly there's a role for both government and employers and pharma to come together to try to reduce access to people receiving prescription painkillers who may not need them, really educating physicians about other ways to be able to manage pain. So at the same time, you're reducing kind of the supply of these drugs that may be getting people addicted, at the same time making sure that treatment is more available both in the cities and in the rural areas where for years we may not have had as many treatment facilities as we need.
And when it comes to accessing that treatment, as we heard in Sean's report earlier, in states like New Hampshire, they're not spending the money on recovery. So help us understand some of the costs associated with prevention versus treatment and recovery.
You know, I think obviously if you can prevent someone from becoming addicted, that can be more cost effective, but even recovery and treatment for these disorders is less expensive than some of the alternatives like incarceration. Estimates are that to treat someone in a methadone clinic for addiction to opioids may be $4,000, $5,000 a year, which is much less expensive than if that individual were incarcerated for a single year.
So why do you think there is that push more so for incarceration versus treatment? Is it just about the money?
No, I think historically people have viewed this as a criminal problem and have tried to look at law enforcement as a way to address this. But I think increasingly we're understanding that this is a disease and a chronic disease. It's a disease that people can struggle with for years. And even if they go into treatment and get clean, that for many people they may relapse. And so I think as we consider how to help people who are addicted, we need to really consider treatment models that don't just view a single episode as being successful, but really treating this as a chronic disease in the same way we treat other chronic diseases like asthma.
And as you mentioned, some of the people who are now suffering from this disease, let's also look at the changing demographics. That stereotype of the poor, uneducated drug user doesn't reflect the reality of what's happening in states like New Hampshire. So what's behind that shift?
Well, and I don't think it's states like New Hampshire. I really think we're seeing that trend throughout the country. This is a disease that is affecting individuals of all racial and ethnic backgrounds. This is a disease that is affecting individuals of all socioeconomic backgrounds. And certainly I think one of the things that may be contributing to that is there may be less stigma for people as opposed to seeking heroin and breaking a crime. You know, there's less stigma maybe attached to maybe sneaking someone's prescription opioid. Or I've had the opioid for my pain, maybe I'm going to try one or two to see how it makes me feel. And down that road, some people follow that road and end up becoming addicted. And so I think that has potentially opened the door to addiction for people who may not have become addicted when the path to addiction was much more through heroin, which involved breaking the law much more explicitly.
Now, Brad, we're obviously in an election year here in the U.S., and we're seeing candidates at some of these at-risk states highlighting the issue of drug abuse. But this problem has been growing for over a decade. What do you think will be the tipping point that will really make policy takers take more drastic action?
You know, I think we may be at that point now. In addition to the candidates, you see action in the president's last budget of $1.2 billion being allocated to go towards increasing treatment. There's legislation pending in the Senate to increase access to physicians who can prescribe medication-assisted treatment, one of the most effective treatments we have for opioid use disorders. The National Governors Association has stepped up and is addressing this issue. So I really think we may have achieved that point, and it's certainly encouraging to see a whole variety of politicians and other stakeholders really coming together and considering a variety of different approaches with money behind it to try to address this growing problem.
All right, lots of developments to watch there. Thank you very much, Brad Stein, joining us.